There's many reasons why I picked Brandon Regional Hospital to attend for my residency training. It has a wonderful reputation in the state of Florida. It's actually the 5th busiest emergency department in terms of volume visits a year in the state. I knew that for me, wanting to practice in community medicine, that I would be successful training in a place with high volume and exposure to patient pathology.
We are considered as the flagship hospital of the West Florida Division. So we have access to a lot of specialties and subspecialties that you may not find in other relatively smaller hospitals. So that makes for a great learning experience. The kind of patients we see, the exposure that the residents have to our faculties, it all adds up to a great learning experience.
In terms of benefits of living in Florida, there's plenty of outdoor activities if that's your thing. There's the beach, there's fishing.
Tampa Bay is awesome. The weather's wonderful, the water is always available, and that is why it's also very healthy to be in residency here because we have many outlets outside of the hospital.
Brandon Regional Hospital is a full-service 422-bed hospital with 5 freestanding ERs throughout the community. We have 17 operating rooms which offer multiple robotic-assisted surgeries and open heart surgery. We also have a full pediatric emergency room and level 3 NICU. Recently, we received an A safety rating by the Leapfrog Group and named a top teaching hospital by Leapfrog Group and IBM Watson Health. Our ACGME accredited graduate medical education program is affiliated with USF Morsani College of Medicine. We offer internal medicine, emergency medicine, obstetrics and gynecology, pathology, surgery, and transitional year programs. We also offer addiction medicine and cardiovascular disease fellowships.
What is a great trait in our GME program is the diversity of faculty that we have, with the diversity of their skills, their knowledge base, and that's what complement each other.
The faculty at Brandon is one of the highlights. It's a fairly young group of physicians, very open and allowing of you to take care of your own patients, which is a huge benefit from the transition out of residency into real life.
We're very fortunate here because we have so many fellowship trained faculty. We have 2 formal ultrasound trained faculty for our ultrasound curriculum. We have an EMS trained faculty. We have an international medicine trained faculty. We have a specific research faculty, and now we have an additional simulation fellowship trained faculty member. We're very fortunate to train here at this emergency department because of the above stated, but also because of the actual facility itself. It's a brand new emergency department. There's 60 beds. There's a separate 15-bed pediatric emergency department. We have a 6-bed psychiatric emergency department within our ED. So those patients are isolated. They have their own safe space. From a resident standpoint, we have our own lounge that's provided to us with constant stocked refrigerated lunches and snacks. Coffees are always available. Most importantly, we have our own computer space outside of the department where we can get work done need be when we're off shift. And we've made it our own little home. We have pictures of us all over because we really are family in residency. We are a family. We are our support system.
In terms of what benefits Brandon has for internal medicine, really the big thing I think is variation and complexity of patients and access to attending physicians and the ability to do all the procedures necessary.
Stroke is a relatively new designations center that we got, which is, I think it's fabulous for the community overall. The TAVR program is going very well. The orthopedic guys are very special as well. They do a lot of advanced procedures. And that's a unique combination of Brandon. So not only we do basic surgeries or procedures or take care of your pneumonias, but also the advanced higher end complex disease conditions across specialties.
Our hospital was voted a top 100 teaching hospital in the United States of America, and I really believe that is translating over to real life because we are seeing it.
Brandon Regional is one of the biggest hospitals in the West Florida Division for HCA. We learn from each other, so there's cross-country collaboration. In fact, we are now considered as the largest provider of graduate medical education in the whole country.
Obviously, being involved with a large corporation is beneficial for residents. Probably the biggest thing is the access to research data and the network they have in place for that.
One of the best things about our residency program, we are an unopposed residency. We have all of our procedures in the emergency department are ours. And then when we're on ICU rotations, our procedures are also our procedures. So while there is a general surgery program, an internal medicine residency program, I do consider us to be an unopposed. We do all of our reductions, our splintings. It's us.
It really is a pretty good family, and the attendings are quite open, and willing to work with you and let you manage those patients.
I think it's a great combination to be a resident here at Brandon. You get the best of both worlds, both the combination of academia and community practice.
We see 125,000 patients a year. That is more than 3 times the national average for an emergency medicine department. We have faculty that are extremely invested in our success. If you plan to practice community emergency medicine, this will be the place to train. You will come out extremely prepared. I have no doubts about it.